So I'm here with Daniel Auclair from the Multiple Myeloma Research Foundation. He is the Senior Vice President of Research, and we're here at ASCO 2016. How are you?
Good, very good.
Good. So thank you for taking the time to come and chat with me today. So in your capacity at the MMRF, and you come to conferences like ASCO, what are your main goals when you're here? What do you really want to bring back to your organization?
Yeah, sure. Our foundation is not your typical foundation because not only do we fund research, we actually do research. We run through this sister organization of ours, the Multiple Myeloma Research Consortium, 67 clinical trials over 30 different agents. So when we come to these meetings, it's often also to present some of our own results on some of these trials or these preclinical activities that we've been doing. But more on top of that, multiple myeloma is maybe the winningest team in cancer right now. It has just in the span of 15 days last November had 3 new drugs approved. I don't think any other cancer has ever done that. 10 new drugs approved in the last decade. So we're really trying to figure out how do we best combine these drugs for patients, giving the best possible treatment to a patient given his or her unique disease profile, a term that we call precision medicine. We heard a lot about precision medicine. President Biden's going to be here tomorrow. We can discuss more about that in a minute. But so we really need to learn more about these drugs, and meetings like this really help us to learn more about these drugs and how to combine them. And then myeloma, although we've been so lucky with these new agents, is far from being cured. There's still about a quarter of our patients who will progress very rapidly, often within 2 years, and sadly will lose their battle with the disease very, very fast. So what we do for these patients that we call these high-risk poor prognosis patients, there's still new drugs needed for that and new approaches needed for that. And obviously everybody's talking about immune approaches, immunotherapy, and for myeloma also there are some great promises. There will be a study presented in about half an hour here that will be presenting the most recent result of a drug that was approved in that span of 15 days last November, Darzalex, in combination with Revlimid, with the proteasome inhibitor, Velcade, and those results were so good actually that the trial stopped early. So we're really talking here about maybe a game changer. And then we've heard about CAR-Ts, we've heard about new monoclonal antibodies, new ways to stimulate the immune system for, in the old days we used to give drugs to patients that would attack their cancer. Now what we're doing actually is giving drugs that fortify the immune system, a bit like when you think about having an infection like flu or something like that. So, and there are some great promises there, even for myeloma patients.
And so, with all these advancements and all the great promises to patients, of course, patients can attend ASCO, but not all of them do. So, when you think about what a patient should really take away from ASCO, what would you like them to most know?
And for us, and this is something important, in the old days, patients used to be seen as human subjects. It's very important for us and for the patient to actually become active participant in the research. And there's different ways to do that. We ourselves are coming out with a patient journey about various steps that any patient, at least myeloma patient, should be taking, but we think any cancer patient should be taking. But there's a number of things that patients should really educate themselves, and it takes a number of important steps. They should know more. They should become a specialist of their own disease, and they should participate more in clinical trials if that's the case, and find, there are ways. All these organizations are coming up with new ways now to listen to the voice of patients, integrate their own concerns into the way we develop these new drugs. For many patients, for example, even traveling 5 miles is a big thing for them. This is kind of why one of the drugs that was approved last year in myeloma is an oral proteasome inhibitor, so the patient don't have to travel and get these IV injections for some of these drugs. You cannot always do that for immune agents, antibodies. It's not always possible. But we're taking great care into listening to the patients, and the patients should educate themselves and go to reputable organizations who can, bring back all that information to them from these scientific meetings.